Welcome to G-NMH 2025, the Global Nursing, Medicine, and Healthcare Conference. This year's gathering brought together healthcare professionals, researchers, and nursing leaders from across the globe to exchange insights and advance the future of patient care. From evidence-based innovation to cross-disciplinary dialogue, the conference sparked ideas that reached beyond the sessions. G-NMH 2025 wasn't just a conference. It was a collective step forward in shaping the next era of global healthcare. Let's take a moment to revisit the highlights of this powerful and inspiring journey. G-NMH 2025 brought together a remarkable lineup of speakers. As we begin our keynote highlights, we start with Professor Dr. Bernd Blobel, a leading authority in medical informatics. With over 600 scientific publications, his pioneering work has helped shape digital health systems across the globe. Let's take a look at the highlights from his presentation.
And we have also enable multi-domain processes by knowledge sharing at domain level for cross-domain cooperation that anyone understands the other and can communicate and collaborate consistently. And for mapping them, we are using the aforementioned top-level ontology according to the ISO standard 21838 to bridge between the different concepts according to the aforementioned schema.
The 40 cm beach ball was spray red to resemble a uterus. The top of the beach ball was cut.
Okay, of course, this is just one of the stations. We have other stations like neonatal resuscitation as well as pediatric resuscitation going on in the other rooms, so that the teams are not just waiting around with idling while waiting for their turn. Okay, so this is a limitation of our current model. The placenta actually came out too quickly and the umbilical cord actually broke. Okay, so we note that and we'll show you how we improve the model subsequently.
PV infection rate among Chinese women is about 15.54. PV infection from this graph that parents that reported that I knew little about HPV vaccine occupied 42%, and 29.2% of parents reported that.
A well-known morphology for every one of us, accelerations are closely linked to fetal movements, indicating a conscious state in the fetus with a tendency to be higher. That's where area under the curve takes relevance.
Practice, whether they've met outcomes of the programme, and things that they require to improve their practice, or any areas of shortfalls in their knowledge or practice can be addressed by the team. With the multidisciplinary team was important, so people felt they worked quite well. Interestingly, and this probably fits with a kind of larger picture, but some of these practitioners in early career felt some inadequacies to some other colleagues, one participant.
Because of two reasons. Reason number one, it can be identified and diagnosed by the imaging without the invasivity of doing the procedures. The scale down, the graph down tells you how many sessions we give. So there is 234 patients. They ended up by only single tier treatments.
They are registered as active nurses first, and then the nurses with at least 1 year of experience in nursing work at their respective hospitals. That deviation is over 20, and for the DWPAs, the level is 55.67.
I suppose as a single intervention, it probably helps. As I mentioned earlier on, Liam has been a constant in our department. Most junior doctors will rotate around, whereas Liam has developed a lot of expertise and knowledge by working with us. So if there's any flux in junior staffing levels, he's...
And as for scarcity, yes, the imported HPV vaccines in China is quite limited, but we are going to figure out solve that problem, because now there are domestically produced vaccines in China.
I'm glad you asked this, Dr. Brown. When I gave my lectures to the residents and studies and students, I told them, please don't think that fluoride is the best one. Please don't think
that it's safe and comes with the less signs and symptoms and complications would compare with the chemotherapy. I'm not sure, is the question is saying chemotherapy, systemic chemotherapy or transarterial chemotherapy? Because if it's only chemotherapy, by far, radioembolization considers to be a modality of choice.
G-NMH 2025 brought together 55 participants from 17 countries, uniting leading voices in nursing, medicine, and healthcare. With 14 expert speakers, the event fostered dialogue across disciplines and borders. This year's program focused on 6 core themes: innovation in nursing education, the rise of telehealth, pediatric nursing advancements, genomic medicine, breakthroughs in oncology, and the growing role of personalized care. Sessions explored both clinical depth and global relevance, highlighting inclusive solutions, translational research, and real-world application. G-NMH 2025 wasn't just a conference. It was a step forward in shaping the future of global health. And the journey continues at G-NMH 2026. A new chapter begins. In mid-2026, the world returns for G-NMH 2026, the Global Nursing, Medicine, and Healthcare Conference. This next edition promises deeper conversations, bold new ideas, and discoveries that will reshape the future of health and care. Proceedings begin June 2025. Stay connected and learn more at www.gnmh-conf.org, because the future of medicine begins now, and it begins with all of us.